p.m. And so just in respect of everyone's time, we're going to go ahead and get started. First off, thank you for joining us for the 2026 virtual open enrollment meeting. We've got a good number of our team on this evening. My name is Bryce Heinbaugh. I'm with the All Better Health team as well as Concierge Nurse Navigators. And we do have, like I said, a number of our team members on. I'm going to introduce Marinette here in a quick second to give some instructions around Spanish-speaking captions. But before we do that, I just want to share with you, if you do have any questions, everyone that's logged in now is automatically muted, but I would recommend any questions you can put in the chat box. We have folks that are monitoring that, and we'll be happy to answer those questions either via response in the chat box or toward the end when we do need to maybe mention a few of these questions openly. So with that, Marinette, are you on?
Yes, I am.
All right, feel free to share how to do this.
Muy buenas tardes a todos. Para el día de hoy, para activar los subtítulos en español, por favor, diríjase a la barra inferior de Zoom y presione en subtítulos o CC. Ahí va a seleccionar elegir idioma de subtítulos y ahí va a elegir español. Si usted no ve la opción de subtítulos, por favor presione a más, que serían los 3 puntitos en la barra inferior. Si tiene alguna duda o pregunta, pues por favor déjenos saber.
Thanks, Marinette. We appreciate that. And again, hopefully everyone has the ability to follow along however you need. But again, my name is Bryce, and I'm going to lead us through this presentation this evening. I will say the numbers I see logged in, this is our largest meeting for the year, so that's good. Thank you again for joining us. And as we get started, just to remind everyone, we're in annual open enrollment period, and which I think you're already aware. It runs from January 1st through the end of the month, January 31st. And so this is the first of a few reminders that you would need to do your open enrollment changes through Dayforce, and by the end of it, and I'll have another brief reminder toward the end just to kind of share with you all. So as we enter in open enrollment, want to keep in mind that whatever we're talking about here is actually going to be effective beginning March 1st. So the new plan will renew and be effective on March 1st. And as we see all these different names and logos on the screen, we just want to kind of set everyone's expectation that there's not a whole lot changing, and quite honestly, very, very little adjustments that we'll go over and review here in a moment. But the company names and logos that you see here will all be a part of the program in 2026. One key logo that you may not recognize, but it's really the same folks and the same organization, is the Carex Health logo. Carex Health is our direct primary care program. So that's really Nextera Health. They just underwent a name change effective January. So they're referred to as Carex, but same docs, same locations, same people. So, as we move forward, I'll go to that next slide. And so one of the first questions that comes to mind, will the plan itself be changing at all? And this is kind of we're going to start right out of the gate and let you know the answer is no. We have really the same structure, the plan design structure that you've come to know and understand this past plan year. We are keeping the deductibles and the out-of-pockets the same. If you're, again, trying to see this, view this, or take a screenshot, don't worry. This same slide is a page in the new benefit guide, and we'll get to that toward the end. But just keeping in mind that kind of that center column there where you see it says in network at the top header, that is our plan, design, and structure. These things are really what you already know and are used to, but also keeping in mind in that yellow shaded column, which is your zero cost options, the resources like your nurse navigators, direct primary care, My Catholic Doctor. All of these zero cost options are going to continue to be available moving forward and through March as well. And the third column on the far right is just if you happen to or choose to go to an out-of-network provider, these benefits and deductibles and coinsurance will remain the same as well. So it's just, again, to settle in that the plan design and structure will continue to be the same March 1st and forward. Now, each and every year, again, as an advisor to the diocese, our team, we review and we look and we listen. We hear what things that are working well, some things that we might need to make some adjustments on. And so this is really, if there were any changes, these are those adjustments. And again, I did these meetings in person last week and talked to many of you, but these are just a little bit of fine-tune adjustments that we're going to chat on and make you aware of. So the first of the 5 is actually not an adjustment at all. It's an addition. It's an addition to another resource that we'll be adding that allows virtual mental and behavioral health services. And I'm going to talk actually on the next slide about ViCare. This is the vendor, the program called ViCare that we'll be adding. And we'll talk about that in just a moment. The second and third bullet point, you're going to see what we'll just call site of care updates. And so they both are very similar in nature, and it really is focused on where we're going for the site of care of these services. So first is colonoscopies. Colonoscopies that you can schedule will now be required and covered only at an outpatient, independent, or freestanding diagnostic center. Again, in parentheses, unless for medical necessity, and I'll give you that example why here in a moment. But the reason for this change, as well as the third bullet point, and I'll share with you in a moment. But as you guys can assume, we're seeing a lot of hospitals adding on additional facility fees and what they call tech fees to a standard colonoscopy. And in some cases, these colonoscopies can be very, very expensive because of the additional facility fees. So if you're scheduling a colonoscopy, and again, hopefully you're working with Nurse Jen or Nurse Kendra, we're going to help navigate and provide you some options for freestanding diagnostic center and not necessarily inside a hospital. Now, the example for medically necessary, I think this is helpful, but for example, if in fact you end up in an emergency room because of maybe a blockage or bleeding, and they say, hey, we're going to need to admit you here, we're going to need to run a colonoscopy to determine what's going on. Now that's medically necessary. And in those cases, I just want to rest assured to you all, those are still covered. That is a necessary event there if they have to take you in through a hospital that way. But scheduled colonoscopies, we just want you to be aware, will be done at an outpatient freestanding center. And again, if you're using the nurses, those can be zero cost colonoscopies regardless. Lymphedema occupational therapy. That's a big words there, but what we want you to understand, again, a site of care change. And this is really making certain that you're aware we'll be doing these services at outpatient facilities or services only in the future. So starting March 1st, we just, again, helping us all avoid these additional facility fees that often can be more expensive than the provider, the doctor that's performing these services. We're going to make a site of care change for lymphedema occupational therapy as well as the colonoscopies. Fourth bullet point, fourth objective here, transplants. Now, this is a big one, but I want you to understand this probably impacts less than 1% of people. But if in fact, a transplant happens to be in your future, could be a heart, lung, kidney, any sort of a transplant, we want you to know that beginning March 1st, we're going to have a kind of an authorization step here that it needs to be in fact coordinated through nurse navigation. And the reason for it, and this one's easy to understand, but ultimately transplants those are very big events for any of us. And if we're focused on quality and safety and truly getting you to the best doctors and facilities that do the most volume of transplants with, again, the best outcomes, we want to make certain that we're helping navigate you to these places. And so again, most instances, we may already be doing that. But just to make certain that everyone is aware, it's going to be a requirement starting March 1st that you do start that process through concierge nurse navigators if in fact you are a transplant candidate. The last adjustment that we have for the new plan year is the last bullet point here. Nutritionist visits are going to be capped at just 12 visits per year. Understanding that nutritionist visits in the past, just I think 2 years ago, there was a limit of only 3 visits. And some of you who may be familiar with Medicare, wildly enough, Medicare only allows 3 hours a year of nutritionist visits. We had to look at this and we reevaluated, okay, what's an appropriate amount for someone that may be trying to undergo a lifestyle change? And so through a committee and through certainly some clinical evidence, we feel 12 is actually more than appropriate. And we're, again, happy to say that we landed at 12 from a perspective of the plan and the coverages. So we just want you to know, again, if you're seeing a nutritionist or you will be soon, that the 12 visit limit will be underway and starting March 1st. Okay, as mentioned to you before, that addition to the new plan is VICARE. And again, wildly enough, we were sharing with our meetings last week in person. It's hard to believe, but it's been 7 years since the COVID crisis, this month, actually. And the one thing that continues to linger on from that crisis is the mental health crisis that came along with it. And in some instances, many will say it's the worst mental health crisis in our history. Well, what that means for us is that there's been and continues to be a shortage of providers for mental and behavioral health services. And so VICARE is being adopted as becoming another tool or resource for plan members to utilize. As you see on the screen, right center, front center, really, there are no pre-authorizations needed for this provider. There are no copays or deductibles for you or your family member. And what VICARE really is a virtual mental and behavioral health service that provides psychologists, psychiatrists. There's also there are nutritionists, counseling services, psychotherapists, which are, again, licensed medical doctors who can prescribe medications and manage medications, simple one like ADHD medications, but also providing care for instances if you have a family member with suicide ideations. VICARE is a great solution in those instances as well. Why we're bringing in VICARE? Twofold reasons. My Catholic Doctor, number one, we've been using My Catholic Doctor, but in instances where we just need a wider breadth of providers, maybe availability, could just be managing medications, as I said, VICARE is just an additional resource for us to be able to help plan members and your families with this service and filling a gap. So Again, these services are available to you. Nurses Jen and Kendra can help connect you or a family member the moment you're ready. So please contact the nurses if in fact ViCare is a solution you need. So Carrick's Health, again, if you joined us late there, I said it earlier, is Nextera Health, our direct primary care program and doctors. And I believe we've got a representative. I'm certain that we had a rep from Carrick's that was going to join us, but let's see here. Dr. Flanagan, are you with us this evening?
You betcha, Bryce.
All right, fantastic. I'm going to just introduce you again, the founder, and many of you met Dr. Flanagan last year. He traveled around the diocese and talked with us at the open enrollment meetings, but he's here to share a kind of an update. We've got some really great news because they've expanded in the Arlington area. And by the way, Matt is the controller of your slides, so just let him know when you're ready to move forward.
Yeah, appreciate that, Bryce. And hello, everybody. I see some familiar faces and greetings to those that are seeing me for the first time. So as Bryce mentioned, I'm the founder and chief medical officer of Carrick's Health. And the short is we had our name Nextera for, gosh, almost 17 years. And as we kept growing, we bought on some mature direct primary care practices that had their own names in Chicago as well as Madison, Wisconsin. So we all just decided to come underneath a new name. So Carrick's, in Greek, it's a play on the Greek term K-E-R-Y-X, which means to guide or shepherd. And so that's what we do. And to Bryce's point, same team. We're growing, but in the Virginia area, it's same physicians and medical staff to help support the diocese. So feel free to go to the next slide, please. Yeah, so for some of you that are already members, and please understand that the diocese plan pays for the membership. So when you come in and see us, there's no copay or bill, and we highly encourage, if you haven't had that first visit, to make that first visit. We'd much rather see you when you're feeling pretty good than when you're sick and scrambling. While we are happy to see you when you're sick, it's really good just to have that relationship so we can get you in, get you scheduled, and take care of things. Oftentimes that can happen in the office same day, but sometimes we could do it virtually as well. So a bit of what we want to chat about is just the kind of the current model. So the current primary care system in America, there are a lot of challenges with it, mainly access, convenience, and cost. I think last time we checked and or heard in the Northern Virginia area, it can take up to 3 to 6 months to find a physician. In the primary care setting, for example, through Inova or some of the other systems there. And then a lot of times their models don't allow for virtual access. You can't call or text your doctor directly. You can't get in for the same day for urgent issues. So there are these barriers in that existing model. And in addition, the cost is just quite tremendous there. Physicians in that model, I used to be one of those physicians in a fee-for-service insurance-based model. I had about 2,500 patients in my panel, and typically I'd see between 25 and 35 patients a day. In my 25 years of medicine, I've never met a doctor that loves that. Typically, especially in the primary care side, we like to sit down with you, get to know you, and spend some time. And so our model at Carrick's Health is not built on insurance. We think coverage is important, but coverage should be for those unpredictable, high dollar hospital ICU stays, not for your primary care. So in our model, think of it like a gym membership, and simply that gym membership is paid by the diocese. I see there's a comment right now, just calling that up, that says, "Hey, I love my doctor." If I could just read that comment, let's see if I can find it. I love my doctor and I don't want to change. I love my current primary care doctors, do not wish to change. If I change to Carrick's Health, would that save the diocese money as well as me? That's a really good question. So some of you may already have a primary care doctor in a system, an insurance-based primary care doctor, and maybe you see him or her once or twice a year. You may love them. You can still see them in this existing model. I believe there just may be a copay or something associated with that. And we can also be your doctor. The difference there is the business model, the access, the convenience, the cost. So when you see us, there's never a copay or a bill, number one. Number two, that existing doctor that you may have a relationship with has no clue who Casey Billington is. They don't know the concierge nurse navigator team. They don't know the way the diocese plan design is set up. They may very well work for Inova. They may refer in-house for things that could be sent elsewhere. For example, our private doctor friends that own their own clinics versus these huge systems. So it's important to ask, who's your doctor working for and who are they being paid by? In our case at Carrick's Health, we work for the diocese. We are paid by the diocese. When we refer you out to imaging centers, to colonoscopies like Bryce was mentioning, for elective procedures, for your medications, we don't have any type of incentive by the system that we work in to do things that, let's say, are incentivized to keep you in that system. Our incentive is to help you directly and be a good steward of your pocketbook as well as the diocese pocketbook. When you're in systems like Inova, a lot of times there's a much higher referral rate to specialty colleagues. And it's not that those doctors don't have the time or they don't have the expertise. It's that they don't have the time because they're seeing about 30 patients a day. So they turf you to cardiology to manage your hypertension. So hopefully I answered that question a little bit. Yes, you potentially could still see that doctor. There may be a cost to that, and that doctor likely is an insurance doctor being paid in that model. The reason we created Carrick's Health, and our original name was Next Era Healthcare, is we wanted 17 years ago to go to the next era of primary care, which we pioneered here in Colorado. And that next era was, we want to be beholden to you, our patient. And we want to work essentially for you and be paid by you or be paid by your employer, not be paid by a third party like Blue Cross or Cigna or United or those types of things. So our patient panels are smaller. The doctors in Virginia may have about, let's say, 300 to 500 patients per panel versus 2,500. Wait times are just about non-existent. Again, our payer here is not an insurance company. It's you, the patient, and or the plan, the employer plan. And the archdiocese or the diocese there said, hey, we want to do something different because our costs are so out of control in that status quo world. That's why they brought Bryce Heinbaugh and Katie Talento in, and then the concierge nurse navigator team in, because they realized that for the amount of money they were paying, which was millions, the access, convenience, connectivity, and service just wasn't where it should be. So that's why you've got us on the call. So that direct primary care, DPC, which you get through Carrick's Health, is baked into your plan. And our docs and clinicians are in all kinds of places, from Ashburn to Manassas, Fairfax, Front Royal, et cetera, et cetera. And a fair amount of those docs are Catholic and part of the diocese themselves, which is really important to us. So I think we maybe could go to the next slide. And please, as we're going along, if there are other questions, feel free to just put them in the chat. So this is a little bit of what I mentioned before. For me, as a doc for 25 years, 15 of those years was as an emergency room physician here in Colorado, working in small and large towns. And what frustrated me as a doctor in the ER was patients were coming in and they were scared, confused, concerned, and they did not have a primary care doctor, or they couldn't get in to see that doctor that day. And as a result, for their earache or sore throat or cough, they were in the emergency room seeing us. And when you come into the ER, we're happy to take care of you, but it is a mess. It's high dollar, and there's a lot of chaos happening in emergency room. And then as my career progressed, you started to see all these urgent cares pop up in America. And if primary care worked well in America, we wouldn't have urgent cares. So this is part of the, let's say, early days of us forming direct primary care here in Colorado. We said we physicians see these problems that patients and physicians and systems are having. We want to fix this, and we can't fix it by just putting more bricks in this wall that's crumbling. We need to create something new. Fast forward to today, there's direct primary care in every state. There are thousands of physicians that are doing this, and we're having a lot of fun. It's the way primary care should be. So short is if you have a life-threatening emergency, you can call us at Carrick's. We're happy to guide you, but we definitely want you going to an emergency room. If you have an urgency, we're available to you 24/7. And you don't get just some kind of nurse hotline or so that you might find at Kaiser. You actually get the clinicians that you know and trust that are talking to you. I will say, though, you may also get concierge nurse navigators, which is way better than most nurse hotlines because they'll help triage and help kind of guide, and they may send you to us or may do some other things. So the plan is designed to really help you. Obviously in your time of need, but we highly encourage you engage so we can sit down and chat with you about your lifestyle. I appreciate Bryce saying, hey, listen, you've got 12 visits a year with your nutritionist. I would encourage everybody to do that. You also have visits with Vicare to help your brain. I would encourage many of you to do that. Like, don't be at the edge of the cliff waiting for something catastrophic to happen. Engage earlier as we're really all trying to reach optimal, right? Like that's the target. We're all preparing for the last decade of life. We don't know when that's going to be. And there's not a pill in the world that's going to solve for that. But there is a lot of exercise, good sleep, lots of excellent nutrition, and taking care of one's mental health. And that's what we have the time to talk to you about at Carex. Next slide, please. So these are some of the locations and the people. Sorry for the small faces. There are real people in those little circles. And there's a variety of them from Manassas to Arlington, where Dr. Hayden's at, as well as Fredericksburg. Ashburn is Dr. Opara and Sarah Olkey. Almost all these physicians, clinicians take care of the whole family. So young ones, 0 of age, all the way up to us older people. And are happy to do so. That's part of primary care. Please go to the next slide. So how do you get started? This QR code, you can actually do that right now. And again, as I kind of parallel it to a gym membership, now's the time to start. You don't want to put your health off. And all of us can do a little something to help improve as we reach optimal health, right? Or targeting that. So it's pretty simple. If you haven't had your colonoscopy and you're above the age 45 or so, if you haven't had your cholesterol checked, if you need mammography screening, if it's been a minute since you've had preventative screening labs, if you want to talk to your doctor and you're a 53-year-old woman moving through some menopausal changes, or a 48-year-old man wondering about your testosterone, like these are all things that we do in primary care. You scan that code, that allows you to schedule online. You get to pick, it's always your choice, the patient, as to which clinician you want to see. So you pick, and it costs you 0 for that, okay? Sometimes people kind of wonder what's the rub. The Archdiocese, the plan is paying for membership. So that's the way the business side works. It's actually pretty simple. Outside of that, next slide. I think we've got here just some reports from patients. I had the most productive meeting to determine good, healthy habits. 10 out of 10 if you want real help with one-on-one attention without being rushed. When you walk into our office, you're going to see a lobby that typically has no one in it. So yes, we are there. Our staff is seeing patients, but you will not see a lobby full of 10 people coughing and hacking and this, that, and the other. Our patients are not transactions, right? Our patients are people. We typically spend an hour or so with you on your first visit. Follow-ups can be a half hour to an hour. We have time. Our doctors maybe see between 5 and 8 patients per day, not 25, okay? So when you walk in, yes, we are open. It's just that you may not find anybody in the lobby. Here's another comment from about Dr. Opara. She was so wonderful and knowledgeable and reassuring. I've never experienced this level of professionalism and care from a healthcare professional. I can't recommend enough. So as the CMO and founder, I want all of you to have an experience like this. We're not perfect. If it's never not that way, and or you're like, hey, here are things I would like or like to see improved, we love feedback. But what we found over the years, and again, this is our 17th year, is this is getting back to the way primary care should be. I'm from a small town in Nebraska. I grew up with that, and in short, we're not innovative all. We're just replicating what I grew up with as a kid. My parents still have today. The innovative part is the business model that takes care of things. So feel free to scan that QR code if you'd like, and we're happy to start taking care of you. I think, is there anything else on my slides?
That's it. That's it. But
Great. I
before,
appreciate the opportunity, Bryce, and I'm happy to answer any questions along the way.
great. Thank you, Doc. Appreciate it greatly. And I'm going to touch on one more thing. Matt, if you could go back to his last slide. Yes, the QR code's there, but I also want to let you guys know the Carrick's team has a direct concierge line there on the bottom left. It's 703-686-3380. That is kind of a white glove phone line that if you want to call and just have them walk you through, give you the options, again, even help schedule. That phone line is, again, a more traditional way of doing it, and they're pleased to help you. So just keep that in mind. You can call them anytime with help locating, getting signed up, and establishing care. I myself have a direct primary care doctor. Our family does. And I can tell you, when Dr. Flanagan says access to care, me spending last week in Virginia driving in your all's traffic, if I can have a doctor on a text message or a phone call almost instantaneously, I'd much rather do that than even think about getting in my car to drive. So again, just want to say thank you. And again, that was a good refresher. So, okay.
Yeah, I appreciate that, Bryce.
Yeah.
And as I pause there, I failed to mention, Bryce,
Mm-hmm.
the care navigation piece that this plan has baked in that I just want to call out directly. Okay, so some of you already know this, but for those that don't, and I apologize to those that do, let's say you come in, you see Dr. Opara, and she's concerned that you have an ACL tear. So she's concerned that you have a musculoskeletal problem in your knee. She care navigates for you and arranges an MRI order, imaging of your knee, calls up and connects with our friends at Concierge Nurse Navigators, Casey Billington's team, and those nurses connect you to an MRI center where you'll get that MRI done probably within a day or two, not weeks. So your MRI is done. That data flows back to Dr. Opara. She then refers you to an orthopedist that she knows and trusts and works with CNN to get you to that orthopedist. That visit will likely happen probably within a shorter amount of time than when you would experience in the traditional system. And moving through that lane and that white glove care navigation gets you to that orthopedic surgeon and gets you that procedure, which could be an ACL repair. That's usually 20 to 40 grand, and can get you that for $0 out of pocket because of the work that CNN and this plan has done for the diocese. So I want to call that specific piece out because while 90+% of your care can happen with us at Carrick's, there are the times where we need to consult with our specialty colleagues and refer you out. And we use concierge nurse navigators in that team to help all that flow. Some of you already experienced that. I'll call it out directly. You will not get that in these other insurance plans. This is why we design things the way they are today. So sorry to take a little bit longer, Bryce, but I failed to mention that, and I just wanted to call that out.
No, that's good. It's a great reminder. So thank you. All right. So concierge nurse navigators. I think many of you on the call here know of Nurse Kendra and Nurse Jen. They've been your go-to nurses over the course of the past year. And we're, again, excited to announce at the same time you all are using them often and frequently. And that's exactly what we had hoped for. And so with that being said, you'll see a third person on the screen here, and this is Shanice. Shanice was hired just a couple months ago to join the team that is serving the Diocese of Arlington. Shanice is their clinical support. Last week, Shanice was just filling in gaps where Kendra and Jen were with us in person at all the meetings. Shanice was answering phone calls and helping gather records, whatever was needed. So Shanice will be a part of the team. And if you again have a conversation with Shanice, just know that she's there and fully dedicated to you and your families, helping Kendra and Jen stay up on all the research and advice that they're providing you guys. Also, just a reminder, this is very important, but the phone numbers for both the nurses, these are direct phone numbers. They're good for voice and they're also HIPAA secure texting lines. Please keep that in mind, knowing that over 50% of all our communications that we receive from you guys and your families, your spouses, come via text message. So we encourage text messaging, perfectly fine. It's secure. Email is also available. If you prefer a long thread of your communication, email is good too. But before I move on to the next slide, I want to remind you all, the nurses are not here for emergencies or emergent situations. And Dr. Flanagan had mentioned it earlier. Feel free to reach your direct primary care doctor in those situations, but the nurses really are for things that you can schedule or for any assistance, help, questions in answering. And so I say that to finish with this. Their phones, as a co-founder and owner of the company, Casey and I have decided that we turn their phones off at 5 p.m. Eastern Standard Time to protect their own work-life balance. They have families, they've got kids, they've got obligations in the evening, and nurses, as you guys know, have big hearts and they'll keep working till they go to bed if we let them. So if you message them, and you feel free to text, you can call or email after hours, nights and weekends, but I want to set the expectation that they're going to do their best to respond to you on the next business day when things come back on for them. Okay, so just keep in mind non-emergencies, next business day if it's after hours. You will not wake them up if you text them. They will not get that till the next day. So again, Shanice is the new team member here, and just keep in mind these numbers are direct to them. So thanks, Matt. Feedback, again, you saw a little bit of feedback with Carix. I don't necessarily need to read this feedback to you, but what this really is, the purpose of us showing this slide is, first off, those of you that have worked with Kendra or Jen have experienced the level of care and again, the trust that you can have in them. They're doing great jobs. But as I know, they work really, really hard for you and your families, and sometimes their days are long and very hard. And so I just want to share with you, if in fact they make an impact for you or a family member, feel free to give them a little bit of encouragement, give them a little feedback, and just say, hey, thanks. This meant a lot to me. That lifts them up and their spirits up. And again, just remember, they're dealing with hard things. People going through cancer journeys, people that are, their kids are sick, and they're hearing all sorts of things. So some days are tougher than others, but great feedback would help go a long way. So thank you again for that. Gentle reminder, again, most of you are familiar with this screen. We've shown it in the past. Some of you may be new hires, but it's always good just to make certain that we have this clear. The key to everything that the nurses do is dead center of this slide, which says, call the nurse first, call before you schedule. I want to remind you all, the power that these nurses have for you and your families is they can make your healthcare free. Things like imaging, MRIs, CT scans, x-rays, procedures of any sort, colonoscopies, biopsies, small things, it doesn't matter, big things, surgeries, knee, hip, spine, shoulder, gallbladder. They have the power to make your care free, but the key to it all is they must communicate with you prior to scheduling, because they have to have in our documentation system, or what they would say is your chart, they must document that they've had a conversation with you, what that conversation entailed, and if they make a recommendation of any sort as to where to go for care or high quality doctor options, those notations have to be in place before you schedule, because once you do render the service, there's a bill or an invoice, a claim occurs, and when the claim comes in to Edison, when it gets processed, by having those notes in advance, it processes with zero patient responsibility, meaning the care is free. It's the only way that it works. And unfortunately, some of you may have forgotten to call in advance, didn't get your guidance from the nurses, and hey, can we retroactively fix this? And candidly, unfortunately, no, it's they're unable to do so. It's just the way that the billing has to happen and process. So I just want to keep that in mind. Contact them before you schedule. Before we move on, my last three pieces here on the screen. Anytime you need a specialist outside of a family doctor, like your DPC doctors, but specialists of any sort, feel free to reach out to the nurses. Not only are they going to check that they're in network for you under the Cigna PPO, but they're also there and available to give you, are these high quality? Do they meet the safety standards? Are these a, good provider group to go to for your care? Second opinions, I said it so many times last week. Second opinions will always be free on this program, and I want to keep this in mind. If a doctor says, "Hey, we can cut on you," or this is a neat, quick, simple surgery, we can take care of you or put you through a treatment. If you're wondering, hey, is this a reason that we should have a second opinion? It does not hurt to take up 1 minute to send a text out to nurses Kendra or Jen and say, "Hey, should we look into this second opinion offering before we go through with this surgery?" You don't need to go anywhere. We help getting your medical records or whatever test results you may have. We send it off to a team of doctors, places like Johns Hopkins or Cleveland Clinic, where we can have a team of doctors look, is the diagnosis appropriate? Did they get it right? Is the treatment reasonable? And so just want to keep you in mind second opinions before you go through with a surgery. High cost medications, I'll get to this maybe again, but I just want to remind you, if you do have a specialty medicine, typically infusions or injections, or you just know, gosh, the cost of that medicine's high, please keep the nurses in mind. They can connect you with our clinical pharmacy team that's going to help with that over at Disclosed RX. And then prenatal care. If you find out you and your spouse are expecting, congratulations. But before your wives schedule that first OB appointment, please keep in mind that if they reach out to the nurse for high quality OB and a safe place to deliver that baby, your family could save thousands on the pregnancy and delivery. Okay, Matt, I'm good for the next one. Okay, as a reminder, but also refresh or new to the plan for new hires. Diabetic supplies, if you have a family member on our health plan through the diocese, all diabetic supplies can be free for you or your family member, including those blood glucose monitors like a Freestyle Libre that, as you know, can be pretty expensive. But test strips, lancets, pen needles, whatever it is that you need, we just need that doctor's order. You can text it over to one of the nurses. We get you set up, and they're having those supplies shipped to your homes. 90 days supplies worth, so you're not doing a dance every 30 days for these things, but you get a 90-day supply each and every time shipped to your home. And then on the left side of the screen, you'll see durable medical equipment. These are sometimes can be very expensive. Knee braces, maybe your kid has a soccer injury, some sort of a walking boot, etc. If in fact a doctor tries to, again, an insurance doctor tries to say, "Hey, we can get you one of these right now," don't let them sell you something from the doctor's office. It can be very expensive, and typically it goes towards your deductible. Just pause the doctor and say, "Doc, all I need actually is the order for this. I have a nurse navigator at work, and we get this for free from my family and I." And then the last piece here is the CPAP machine that's in this list. That's probably the heaviest hitter. A lot of folks utilize this program, but CPAP machines can be entirely free, including the supplies, ongoing supplies. Just need a doctor's order. Sometimes that means a sleep study or an updated sleep study. Just get the order for the sleep study. Text it over to the nurses. We get the machine, send it to your house. You sleep in your own bed, give the doctor your results, and typically 3 to 4 weeks, a brand new CPAP machine is available there at your home. Okay. So just keep that in mind, all zero cost. Virtual care. Some of you that, actually, I heard a lot of you last week say, "Yes, My Catholic Doctor's been great for us. We've been using it, for whatever it may be. Could be, virtual urgent care. But many of you are using it for counseling, sometimes even mental health type services. But do keep in mind they have fertility care and planning, natural family planning. They do have a vast majority of doctors that can help you if again you're not signed up with direct primary care. This is a good alternative for nights and weekends, or just simply not getting in your car to drive to a urgent care. Licensed doctors that can, if you need a antibiotic or something like that, these folks can prescribe, and you just pick up at your pharmacy. So continue to keep in mind My Catholic Doctor in the future. The care team, just kind of, we do like to lay it out, when to call who. And so this is the care team that we provide for you all for zero cost care. And these zero cost options through nurse navigation is, scheduled care. So if you're, again, anything that you can schedule, contact the nurses ahead of time, and it can be free. Carex and the direct primary care docs, again, Dr. Flanagan mentioned, hey, even if it's emergent, feel free to contact your DPC doctor. They'll walk you through where you should be going, or if they can help you right then and there, they will. But also family medicine, chronic condition management, all of these things, again, with Carex at no cost, and then My Catholic Doctor, which I just mentioned previously. This is a great reminder. I just want everyone to be reminded that we have a membership. The diocese has a membership with the National Catholic Bioethics Center, or NCBC for short. NCBC is a great resource for anyone that may in fact be dealing with a complex decision, things such as end of life, maybe a complex pregnancy, fertility care, things of that nature. NCBC is available to you at zero cost consultations. If in fact you're experiencing or walking through one of these tough decisions, contact one of the nurses. They're glad to connect you to NCBC. Okay, prescription medications. This slide, again, just a quick reminder, nothing's changing here. So the slide itself shows all the different tiers of the medications and the copays, what you've already begun to get used to. The real piece in the reminder here on this slide is Tier 4 specialty medications. The purpose of this is just to remind you we have a two-step authorization process there because these medicines can be very, very expensive. I was kidding around with folks in the meetings last week, but I watched 2 NFL playoff games the previous Sunday. I saw 5 Skyrizi commercials. And that's a great example of what a high-cost specialty medicine is. But for many that don't know, that medicine can per round, maybe monthly, bill out $50,000 to $60,000. These are expensive medicines. So if in fact this, a doctor prescribes you one of these, please know, contact the nurse first, and then they'll hand you off to one of the pharmacists at Disclosed RX, who will work with you and your family member to, again, making certain we're getting the best price for the medication, and also if they're, if it's an infusion, making certain that we're getting to the most affordable place to have that infusion handled. So Disclosed RX is our medication manager. Okay, ID card. I know many of you who've been in the previous meetings, even from last year, or if you've been in the meetings last week, just reminding you all, this is what the ID cards look like. But the real piece and the reason for showing you this is you notice the logo on the ID card, the Catholic Diocese of Arlington. This is the reminder to everyone. We are a self-insured organization for our medical and prescription drugs. And so as a reminder, when you guys go to the doctor, the hospital, or the pharmacy, it's not insurance company money that pays your bills. It's the dollars that are taken from everyone's paychecks, the deductions that are collected each and every paycheck, as well as the bigger budgeted dollars of the parishes, schools, the diocese itself. Each and every dollar is, again, utilized to pay for, everyone's medical and prescription expenses. So the kind of, that saying, we're in it together, that's really what it is. We don't purchase insurance through Cigna, even though the logo is on the ID card, you guys. We're just renting their PPO network. It's really your all's dollars that are helping each other afford this cost and care. And so keeping in mind that Edison, who is our plan administrator, they process all of our bills and claims, but Cigna is the PPO network that allows us the access to doctors and hospitals throughout the country. The last logo on the ID card is Disclosed RX, and that again is so that you can fill a medication at any pharmacy nationwide. They recognize Disclosed RX. So that's the real reminder there. We're self-insured. Couple again, quick references. Cigna does have a website that you can go to and you can, search doctors and network providers. But I want to again remind you, you can do that self-help, but the easier way and the better way is to reach one of the nurses, because not only will they check that the provider and confirm they're in network, but they'll also gladly provide you the quality and safety of that doctor. Okay, so keep in mind, if you're self-help and you just want to do it yourself, Cigna can at least identify in-network doctors for you. And then on the right side is the Edison member portal. As a reminder, two main reasons that I can think of often. Why would you use the Edison portal? First one is for explanations of benefits. If in fact you get a hospital bill at home and you look at the patient responsibility and it's not zero, but in fact it's maybe a few $100s, well, do you really owe it? You may ask yourself, do I pay this bill? Is this right? I want to encourage you to hopping onto the Edison member portal and pull the explanation of benefits that goes along with that hospital bill. As long as the patient responsibility matches on the EOB, patient responsibility, then yes, you likely owe that bill from the hospital. But if it doesn't match, it should trigger a reminder that maybe something is not right. Maybe the bill didn't process correctly, or we just need to rerun it. And if that's the case, I want to remind you, don't pay a hospital bill that you don't check the EOB first with, because it's going to be real hard if you got to try to get a refund from that hospital. Okay. The second reason for the member portal at Edison is your digital ID cards. I've got my phone here in front of me. I don't carry an ID card with me, whether that's good or bad. I travel across the country, but I access my ID card through the member portal. So if I have to pick up a prescription or something while I'm traveling, my ID card's just on my phone. Edison's portal allows you to pull your ID card or order more if you need so. Thanks, Matt. Okay, we're going to shift over real briefly here, and then I'll on ancillary benefits, and I'll talk a little bit about Dayforce, but we'll get you guys out of here in just a moment. Ancillary coverages, dental, vision, life insurance. First off, good news, no real big changes. The benefits and coverages are going to remain the same. We've got a slight change on the dental premiums. The dental premiums are going to tick up 5% beginning March 1st. Now, yes, it is 5%, but just because dental insurance is, again, typically a lower cost item, it's not a lot of dollars at all. But MetLife is, again, sharing with us, hey, dentist office are charging us more, and due to inflation, things just need to go up in price. So 5% increase on the dental, but the same fantastic benefits. You guys have a very rich dental plan here with $1,500 of benefits and coverage each year per family member. So keep that in mind. And then on the vision through VSP, no changes in premiums, no changes at all in the benefits. All your allowances will be still pretty high. Frames every year, $220 allowance. Lenses, $200 allowance. And again, contact lenses, a $200 allowance. These are really good vision benefits, but just keep in mind MetLife and VSP. And then on the life insurance, as a gentle reminder, if you're a full-time employee, the diocese covers 2 times your base salary. So if you earn $50,000 a year, you're covered on the life insurance for a $100,000 benefit. I think that makes sense to most everyone. Do know that there's also supplemental life insurance available for you, your spouse, or your dependents. And what that means is you have the ability voluntarily to purchase more coverage if you so wish. Now, one thing I need to be clear before we go to the next slide. If you have been working for the diocese, again, as an employee for a while, yes, you can, during open enrollment, choose to purchase or elect more life insurance. But I want you to understand by doing so, it triggers what is called an evidence of insurability form, or really what I also like to say is health questions. So keep this in mind. Only if you are a new hire and you've never done this before, would you not have an evidence of insurability form? Matt, that next slide, I'm going to move right over to it. So in EOI or health question form, they will send this out to you if you choose to purchase additional supplemental coverage. You need to respond to it pretty quickly or they'll close your file. But the health questions are required if in fact you start to put in some amounts that are higher than what's given from the diocese. Now, if you are a new hire, this first bullet point here under employee life insurance, if you are a new hire, you have a one-time opportunity. It's called guaranteed issue, and you can purchase up to $150,000 in additional life insurance with no health questions. So I give an example of myself, you guys, because it's easy to pick on me, but I've had open heart surgery. And typically I would not qualify for additional life insurance because of the health questions. But if I were a new hire, I wouldn't have to answer any health questions and I could elect up to 150,000 guaranteed issue. That's a good example. Spouses, same thing, you guys. There can be guaranteed issue if you're a new hire in the guaranteed issue slot. But if you are purchasing additional life insurance and you've been an employee for a while, but you're trying more additional for your spouse or kiddos, they would ask these health questions as well. Okay, so the money side of this. On the medical side, I just want to share with you guys, it's no surprise. I think everybody knows that healthcare and health insurance has been the topic of conversation for the past few months. Back in October, November, we started to hear, national news saying, hey, health costs and health insurance. The Wall Street Journal reported on this, but they said in 2026, employers and the employees will see some of the greatest hikes in healthcare costs in the past 15 years. They're anticipating inflation. They're anticipating hospitals and doctors raising costs, things like that. So what we've seen across the industry and the segment, the industrial side, the private sector, is health increases 10 to 30% across the board. The federal workers, which we know is the largest health plan in America, with over 8 million federal employees on the plan, they just received a 12% increase across the country for their 2026 health insurance. And then, as many of you know, the government shutdown this past fall. What was that mainly about? Healthcare, and in particular, the marketplace, the subsidies. We've seen marketplace plans going anywhere from 10 to 30% as well before the subsidies were ever removed. So the cost of care going up. For us here at the diocese and all of you, yes, we're going up. This red font represents what the increase is going to be. It's a 5% increase, but we want you to understand it's not that things aren't going well at all. We hired an actuarial firm that helped us with our 2026 projections and budget. And based on what we know inflationary costs to be, it was prudent, wise, and conservative for us to just raise the budget 5% for our healthcare and prescription medication costs. So making certain that we budget enough. It will be a 5% increase beginning March. You will see this, but no, it could have been much, much worse. And we're glad to share with you that we in the diocese were able to keep it at just 5%. So hang with us as we go into the new year. Again, knowing that your out-of-pocket costs are not changing and you still have all these zero cost options that we've been talking about, I think we're in a good place. We're hopeful that this coming year we're going to control the budget and control our spending well with, again, your all's help in using these resources. The premiums, I think, you guys, if you want to take a picture or snapshot of this, you can, feel free, but I want you to know these numbers are in Dayforce as well. They will be in the benefit guide. But these numbers represent, again, per pay on the far right-hand column. Your medical premiums are at the top, dental in the middle, and vision on the bottom. But these will be the new rates effective March 1st, and they'll go forth through February 27th. So the diocese asked us to please just kind of walk through Dayforce for some folks. If in fact anyone is looking for documentation, benefit guide, summary of benefit coverages, any compliance type notices, once you log into Dayforce, the overview tab at the top of the screen, which you see the arrow in the middle, the overview tab is where you find these. Click overview. And as it says there, step 4, scroll all the way down to the bottom and you'll see all of the documents that you could need for reference right there available. You can open them, you can save them, download them, print them as needed. The next slide is actually a piece here. Actually, Matt, I'm going to ask you to jump right to the next one. Yep. So enrolling or making changes. First, the tab that says current elections. This is key for knowing, well, remind me who is enrolled of my family. What do we have already? The current elections tab allows you to see what you have currently in place. You'll see that there's also a button that says start enrollment. You have the ability, I think that may even be on the home page of Dayforce or through the overview tab. But you can see you can start the enrollment process by clicking that button there. So referencing your current elections and then starting enrollment with that key button. Matt, back to the previous. The good news, many of you will recall, and I think most everyone does. Last year, a year ago, we were doing these meetings and we had to share with everyone, hey, open enrollment, is an active open enrollment last year. We had everybody required to log into Dayforce, make your elections or waive the insurance, make certain that you click submit before the deadline. The good news is here this year for open enrollment, because we're not having a lot of changes, the ability to have a passive open enrollment, we're taking advantage of it. So if in fact you're happy with how everything is, your elections, and you really don't want to make any changes, it's okay. You don't have to. Whatever you have today, we'll just roll over and renew into March 1st into the new plan year. Now, that's easy peasy, but I will say to you, if you forget to do this, same thing goes. If you forget to make any changes, sadly enough, if you don't do it by January 31st, it's going to auto renew whatever you have today. So, it's kind of, 6 to 1, half a dozen other, but it is a passive enrollment, which is good news for most people. Matt, if you'd forward 2 slides. This is the reminder. I want everyone to kind of keep this in mind. Open enrollment's done through Dayforce. You can enroll or waive the insurance or make any changes you want, but make certain you hit submit at the end so it does go in effect. But the final day here to do so is January 31st, which happens to fall on a Saturday. We want you to remember that benefit managers, the HR department at the diocese, if you wait till the very last day to do your open enrollment and you have questions or something goes wrong and you're clicking away and you need help, just know that they will not be available on that Saturday, January 31st. So we would encourage you at the very latest, Friday the 30th, but try to get it in advance. I mean, we're closing in. Today's the 22nd. We are closing in on the deadline, so maybe try to get it sooner than later completed. Last slide. So this is an opportunity for you all, if you so wish, to go through or to screenshot a QR code through your, not screenshot, through your cell phones opening your camera app, you can scan the QR code here and move on to the benefit guide. Also the opportunity to save the 2026 benefit guide to your phone for reference. When I say save, it actually just becomes an app on your phone for reference at any time. But feel free to scan the QR code. You can also text out by sharing the benefit guide with a spouse. You can text the link out and they can have it too. Okay, as we move, let's see here, as we move into, what time is it? Yep, 7. Okay, so I don't necessarily know, I'm relying on my team. Questions that either justify being spoken out loud for everyone to hear an answer to? Are there, Casey, Matt, are there any questions that should be mentioned verbally here at this time from the chat box?
No, I think that we've answered all of the questions in the chat. And again, if you have any additional questions, if they're related to the plan, I put the account team's email in the chat. You can feel free to email them, or you can reach out to one of the nurses tomorrow, or to Shanice. They'll be happy to direct you as well.
And we can, if again, let's see here. Oh yeah, we had quite the chat. I wasn't paying any attention to the chat box. Okay, so yes, fantastic. Yes, with that, the recording, we had a few people ask early on. So yes, this was recorded, and yes, we will distribute it. Likely it will be, Matt, do you know the answers to this by any chance? Will it be available either on Dayforce, or will they need to request it through a benefit manager or the HR team? Do you know that?
Believe it's going to be available through Dayforce, but I'm not 100% sure. I know it's going to be communicated out where it's going to be available.
It'll be available. Okay. So
Bryce, this is Terry. We are going to post it on Dayforce, and we are also going to send the link once we have it out as well. So both places.
Thank you for the clarification, Terry.
You're welcome.
So yes, feel free to share it. Again, if you know of a coworker or someone that maybe didn't get to any of the meetings, let them know, please. And yeah, so with that, again,
Bryce,
thanks.
one quick
Casey.
question here.
Yeah.
Someone just asked that they don't understand the new passive enrollment. So can you just explain the difference between active and passive, please?
Yep. So again, this year is passive enrollment, which means if you've been enrolled already and you make no changes, if you don't log into Dayforce and make any edits or changes, whatever you have elected now, currently, it will auto renew. It will roll over into the new plan year effective March 1st. So that was really a reminder for anyone who does forget to do this, or again is just pleased with the current elections. You don't necessarily are not required. Last year it was required. Last year was called an active open enrollment, and it was required that everyone log in and make your submissions.
And then Bryce, one last question in the chat about canceling a plan mid-year.
Yep, a great question. Thank you. So this is a very, very good question. So typically, the only way if you need to term the plan throughout the year, it's only typically going to be allowed through what's called a qualifying life event. And just so you know, and this is good on the same way, anytime next year that you have a qualifying life event, which is a marriage, a death, a divorce, separation, adoption of a child, if I didn't say birth, a birth, or you lose existing coverage elsewhere. Maybe you're currently enrolled with a spouse somewhere, or your spouse works somewhere and captures their insurance from that workplace, but loses coverage. These are all considered qualifying life events. The first reminder is that you have to notify your business manager or HR team within 30 days of that date of event in order to be able to either add or make changes. If you fail to do that within 30 days, unfortunately, you won't be able to make any changes or additions until the next open enrollment period. For someone who asked that question, can we terminate this plan mid-year? Again, I'm sorry, but only in fact if you have a qualifying life event that would allow you to go on to maybe a spouse's new coverage or open enrollment. It does require a qualifying life event. This is not rules set forth by the diocese. These are rules really under the IRS, which is called Section 125, and how you enroll in a plan. You lock yourself in unless it's a qualifying life event. Okay, there we go. I see that. Thank you. Good. Any other questions here since you have us? Yep, and I see that. Thank you, Terry, for that clarification there. Okay. Well, listen, folks, I just want to see, yeah, I know we had over 60 people join us tonight. Thank you. Thanks for joining. I hope this was helpful as a great reminder. If we can be of any help, I see Nurse Jen's on here and Shanice as well. So thank you both for extending your days with us. And again, we look forward to serving the diocese, you and your families in the coming year. And if we can be of any help in the meantime, please just let us know. So thank you all very much.